Hello everybody, so this is Dr. Raghuram speaking for Easy Ayurveda. Today we will be discussing about the most important concept which is very much popular in the modern medicine and which was popular in Ayurveda always. So the modern science is digging into these things of late, but Ayurveda had explored all these things long before. The important concept of P4 medication. What we know about these diseases is most of the diseases and the diagnosis and the diagnostic tools which are there right now till few years back or maybe 2 decades back or a decade back, they were moreover reactive. There was a wait till the disease is formed, wait till the symptoms are formed, wait till the symptoms are displayed, let the symptoms be formed, and then we will diagnose the disease, and we will only after the diagnosis. It is a step ladder pattern, once the disease reaction starts in the body, so then slowly the symptoms develop, we wait and then react to that. So just like somebody throws a ball at you, so you react by catching it. But is there any scope that by seeing the person in front of you, you would predict that the person might harm you by throwing something against you? This is the first thing what we will be discussing in the P4 medicine, the prediction before the disease is manifested. So just by seeing the clouds we can predict it might rain. Okay, will it rain? We are not sure. It might rain, it might not rain, but the prediction is it might rain, and then I carry an umbrella. So I may not get an opportunity to use the umbrella at all, but I have predicted that it may be rain, so that I will be protective about myself. So this is about the predictive aspect. The modern science has slowly come up towards. I will just be discussing the Ayurvedic aspects, what Ayurveda has to contribute to this particular predictive medication. Then coming to the second compartment or the second member of the P4 medications, all P4 we call it as, they start with P and P. So there has been a graduation to P5 and P6 which we will not be touching right now. So the next one will be the preventive. So prevention is better than cure, we already know. So that the preventive aspects moreover depend on the prediction. Like opening an umbrella or carrying an umbrella depends on your prediction of rain by seeing the clouds. You see the clouds and predict the rain, that is prediction. And prevention, to prevent yourself from getting drenched, you carry the umbrella. So this can be considered as two sides of the same coin, like a prediction and prevention both being interrelated. And then personalization, very important concept which we will be discussing in the future videos. Personalization of the medication. Ayurveda was the pioneer of personalization of medication. I must tell, Ayurveda was the earliest medical science or any science to have a personalized approach towards treating the disorders. So the modern medicine is also coming towards personalization. And lastly, when we go to the participatory medicine. So participatory is, it is not only important, or it is not just important that the physician diagnoses the disease and breaks his head on preparing a protocol or the blueprint, how this disease should be tackled, how I can give a cure to the patient. It is equally important that the patient actively participates in the treatment process and the healing process. He should feel, I am suffering from this problem, I need to get rid of this problem, the doctor is trying to help me, I shall participate. So this participation comes as we participate in the household activities in a home. So it is not good that only the father works or only the mother works. So it's a team entirely, the father, mother, kids, grandparents, everybody together. If they give their services in the household work, then the works will be finished and accomplished in a good quality and in a better time. So that it's all about the time management also. So these four are very important key components of the P4 medication, that is a predictive, preventive, personalization of medicine and participatory medicine. Slowly, by adopting these methods, what we are doing is we are slowly graduating from a reactive to a proactive phase. Okay, we used to react to the diseases. So once the disease with its symptoms comes, we used to react by giving the medication. Like there is a fever, the modern doctors would have written the paracetamol. So there is a pain in your joints or soreness in your muscle, an ibuprofen or a diclofenac would have been written, probably with an acetaminophen. So this was reactive. Seeing the condition, I prescribe. Then the success rate, when the success rates were seen in a mixed proportions, when success was not very good in the clinical practice, so the systems medicine came into the practice. So we'll discuss about the system medicine, it is a big topic later. So P4 medication became an important component of the systems medication, where the new technologies are used. So new markers are found out before the disease is manifested, and they are addressed in the initial stages itself. Very importantly for us, this P4 medications play a key role in moreover prevention of the diseases, earlier prediction, prevention of the conditions if possible, and treating the conditions at a personal level. If we have 3 patients having X, Y and Z, we handle all those 3 patients individually. I shall give you an example. I have been doing this personalized practice since 20 years. So I have 3 patients of arthritis, knee arthritis, pain in the knee joints. All 3 are men, belong to age group of like 45 years. See, what was reactive was, there is an arthritis, there is a pain, I will give a painkiller and get rid of the pain. If I give a medicine X to all these 3 people, one person may be relieved by 50%, another person may be relieved by 70%, another person may be relieved by 20%. Okay, A, B and C. So why there is a marked difference in the results we get by giving the same medication to the same aged person, to the same disease, of the same duration, of the same intensity. So here the medical system has learned that a generalization of medication, that this X is applicable to A, B, C, D and E patients, has gone away. Now A should be treated as A, B should be treated as B, C as C, D as D and E as E, with a differential approach. So like they should be individualized and they should be characterized so that these are the people which needs different intervention, though they have the same health issues.